my dissection of the heart. I'm going to show the external features of the heart. This is the right side of the heart. This is the left side of the heart. This is much softer because this only delivers blood to the lungs, whereas the left side of the heart delivers blood to the rest of the body. This is the apex of the heart, the pointed end, which is contained on the left side of the heart. So here at the top of the heart, we have the auricles. These are the large flaps that are at the top of the heart here. Next to the auricles, we have the opening to the superior vena cava, which brings blood from the top half of the heart to the right side of the body. And the superior vena cava is right here. On the outside of the heart, we have the auricles here, which are these large flaps. And then we have the superior vena cava, which is right here, this opening here. And the superior vena cava brings blood from the top half of the body to the right atrium, which is directly below. Here, where I place my probe, is the inferior vena cava. This brings blood from the lower tissues. Next to this is the pulmonary vein, which is right here, and this brings blood from the lungs into the left atrium. Straight atop the center of the heart is the aorta. This is the largest vein in the heart, and this takes the oxygenated blood from the left ventricle to the rest of the body. The aorta branches into more arteries than one, which has been severed here. The last part of my heart here is the pulmonary artery, and this takes blood from the right ventricle to the lungs. Here I'm going to make my first cut into the superior vena cava. Cut down into the right atrium and right ventricle. Spread the heart apart. And here we have some of the internal anatomy of the heart. We have the tricuspid valve here. We have the chordae tendineae on the inside here. The little ligaments that connect the two are also called the heartstrings. Here we have the papillary muscle, this large dark muscle here. We have the right ventricle as well. The larger left ventricle, as you can see, my probe in the left ventricle here. Here I'm going to insert my probe into the pulmonary artery. As you can see, it will come through to the right ventricle. The next incision I'm going to make is from the pulmonary artery down through the right ventricle. First here we have the pulmonary seminolnar valve, which prevents blood from flowing back into the right ventricle. Here we have the mitral valve between the left atrium and ventricle. And here, if I take my probe and I insert it in the aorta, it will come out into the left ventricle and through the aortic semilunar valve, which prevents blood from flowing back into the left ventricle. Sure, a safe procedure, you're always going to want clean hands, so before you start, you're always going to wash your hands. And before you pick up any heart or any brain, you're always going to want to put on a glove. When you begin your dissection, when you cut your heart, you always want to cut away from your hands or away from your body in a manner that won't cut you or harm you. Finish with your dissection, you're going to want to remove your gloves, and then once again, wash your hands to make sure that you have no materials or any fluid on your hands. Make sure you have no cuts. You want to dry your hands off and maybe use some hand sanitizer, and then dispose of your lab materials.